The principle behind treating positive BCL6 is indeed based on treatment of endometriosis, since endometriosis is the most probable cause for the elevated BCL6. And typically the two options are either surgical or estrogen suppression. And I do offer both options to my patients and try to get an assessment of what their preferences are. And I think both approaches are quite effective, but there are some patients who, for example, they have had chronic pelvic pain and they would like to do a surgery to see if that can simultaneously also alleviate some of those symptoms. So for those patients, I think surgical approach may be better. There are some patients who really want to know if they have endometriosis or not. So for some of those patients, again, they may prefer to go to the surgical approach. There are also patients who would prefer to do a surgery only if it's absolutely necessary. And I think for those patients, we would use the estrogen suppression. In some ways, it doesn't have any surgical risks. So it does have some risks, but these are more from a medical perspective in terms of hot flashes, potential bone density loss. But I think it's ultimately it's a decision between the physician and the patient which modality is a better fit for their goals.